Hi, Dr. Gullberg here, continuing our internal medicine lecture series. Today we're talking about the topic of polycythemia, where people present with an increase in their hemoglobin and hematocrit. So there's basically broken up into two categories, primary and secondary polycythemia. Primary polycythemia, of course, is called polycythemia rubra vera, or PRV. This is a myeloproliferative syndrome, also called erythemia. These patients present with not only an elevated hemoglobin, but they have headaches, they have vertigo, they often have hepatosplenomegaly, and phlebotomy, of course, is the mainstay treatment for this disease. There's usually a mutation in the JAK2 gene in about 95% of cases. Most of the time in our practices, we're going to see people who have secondary polycythemia. These are patients who have a natural or an artificial increase in their erythropoietin hormone. So simple things like altitude can cause this, but more commonly our patients who have COPD, asthma, chronic hypoxemia will have elevations of their hemoglobin. Sleep apnea can induce this problem, as can congenital heart disease, renal and liver tumors, as well as elevated testosterone from anabolic steroids. So we'll see this in patients who take steroids, in powerlifting or those types of endeavors. There is a syndrome called Guise-Bach syndrome that is seen in hypertensive, obese men who are generally on diuretics, so they get a volume contraction. They generally smoke and drink alcohol excessively. So that's something else that will increase the hemoglobin. So be aware of primary and secondary polycythemia, especially the causes of secondary polycythemia, kind of the differential diagnosis there. And some of the times we can fix it, some of the times we can't. Generally, we put people on make sure they're on a baby aspirin or full dose aspirin, and stay very well hydrated. Thanks, Dr. Gullberg, signing off.